This video is a very helpful video for those male and female in a very active sexual lifestyle. This is a clinic. I always come over here to get the medicine. It's called PrEP. It will be a medicine to prevent HIV. I'm going to share with you the experience with my friend Dr. John. This video is mostly share with you to ask you to get prevention, get tested. It's not ask you to be active like me. This is called Amd Clinic. They offer a lot of the STD and vaccinated and a lot of the sexual related treatments. It's also a regular clinic, but it is really far away from the town area. So which means that it'll be more discreet if you are actually having any STD issue. You don't wish to have record in your country, or you don't want to bump to your friends or client. You can come all the way here. It's about like 13 minutes away from JB. It's Malaysia, so I actually came from Singapore all the way here to support my friends. I've been taking PrEP for a very long time, so I'm going to show you the procedure to get the PrEP. Let's go. So good that I have my friends here, the Dr. Jonathan. So he's my regular doctor that I will ask him for free consultation. No, actually. So Dr. John can speak English, Bahasa,
Mandarin not bad here and there.
Cantonese also not.
Can lah.
It's quite a good one. So that if you have any friends or your family's member would like to see Dr. John for any other consultation, also can bring him over here. But this video we're going to talk about PrEP. So PrEP, for me, what I will tell you that PrEP is kind of the medicines that for you to prevent HIV infection. But what in a professional way, what doctor would call PrEP as?
Alright, so PrEP is actually called pre-exposure prophylaxis. So it's a medication that you take prior to sexual contact, and it can be used to prevent HIV up to 97%. Okay, so if you were to compare PrEP versus condoms we still have about 98% effectiveness. But if in some cases your condom broke, it did not, it slipped out, or was not used, so there is no 98%.
Correct. So what we do is that sometimes I use both. So I take daily PrEP, and then sometimes I use rubber. So but as a professional doctor, usually will advise use both, right?
Yeah. From a medical perspective, we do agree that condoms prevents at least gonorrhea, chlamydia, and other types of STDs. But of course, those are usually treatable as compared to HIV. It's a long process, and you might need medications lifelong until we find a cure for HIV.
Correct. So other than PrEP, there's another item is called PEP.
If you're talking about PEP, that is different. PEP is called post-exposure prophylaxis. Is for people who have never taken PrEP before.
Never.
Yes. And then they had some exposure that was high risk. It can be anything. Kissing you can feel blood, although we will say the risk is quite low, but sometimes patients are very anxious and very scared. So that is why they might even ask for PrEP, which we still provide if you think that you feel you want to have an extra protection. But PrEP is supposed to be used to prevent HIV, not for treatment. Is to prevent after any high risk contact if you have not been on PrEP.
So what about undetectable? So they are taking a different medicine.
Totally a different thing.
So maybe we can talk about that next time. Yeah, it's gonna be very long. So usually when I come over here every 3 months, the best way. There are lots of people selling the PrEP online, which is quite risky. Of course, that is much more cheaper. But we will strongly recommend, doctor will strongly recommend to get blood tests. So this is what I do now. I will get my blood draw and then test everything, any other STD at the same time, then to make sure my kidney and my liver is functional, is suitable to continue to use PrEP.
Yes, exactly. So PrEP doesn't mean that you have 100% possibility that you will not be able to contract HIV, but of course it reduces your risk significantly.
I've been taking PrEP about 10 years, been very actively and a little bit risky. Not asking you to do that like me, but but it's just like I will say that I still trust this product very well. So there's two ways to consume the PrEP. It's one is daily like me. It's just like a birth control pill you have to eat every day. Around 24 hours, +2 and -2, right? Or there's another way is it's called PrEP on demand, which is doctor always not recommend to do that. Yeah.
So basically, PrEP, you will have a daily dose and there's always a loading phase. So you need to start on PrEP for at least a few days prior to your sexual contact if you're on daily, and you must continue for a minimum of 7 days from any last sexual contact. So it has to be taken on a daily basis. You can stop, but there is always a protocol to stop, which I think you need to discuss with your doctor. When it comes to PrEP on demand, that will be a little bit more complicated because PrEP on demand has never been studied in Asian population. It has only been studied in the European and more to the US community, who are on PrEP on demand. So this, for Asians, it may differ in terms of its efficacy.
I see. So usually when I come over here, I would strongly recommend you to go online, make an online appointment. You can we choose doctor? No, cannot, right?
You can. You just have to search for my slot.
Yeah, because I only the first time I go online, and then the rest of the time I just text him. So it's very convenient for me. It's like, hey, free or not? Come down. So what you need to do is make sure you make online appointment, because you can do walk-in, but because sometimes I came here, it's really busy. Sometimes it can be like not the peak period, because it's still a regular clinic. Dr. John will still have to look for any other patient for other cases, and there is still another doctor right over here, and Dr. John is going to open a new clinic very soon in town. If you're going for convenient, you can go to the new clinic, and if you want to be more discreet, you can always come over here. It's really far away from everything, and I don't think you can meet any one of your friend and client. If you meet your friends and client, there must be something on as well. Or they are just coming here to do the regular testing. The reason why I like to do my screening here, because at Dr. John, they have some machine right over here can do the test.
Yes, we do have our own PCR machines. So it is usually very convenient for you to get results within like 75 minutes to 90 minutes. It depends which test we are doing.
And the reason why I don't do it in Singapore, because sometimes in Singapore you have to make appointment for like weeks before, or like if you walk in, it's gonna be spent whole day. No joke, for the proper skin clinic in Singapore, it's literally you waste like at least 5 hours and above for a walk-in guest. So if you really cannot wait or anything emergency, you still can contact Dr. John, like the PEP. Then Dr. John will help you with the issues which I saw he will rush to deliver medicine for some emergency use.
We do.
Yeah. So the procedure right over here to get tested, we'll draw the blood, and then what else we do?
First of all, when we do the registration, we will put you under anonymous. So we have
let me show you something. Can I show it?
Yeah, sure.
So for my very first time, Dr. John will ask me to fill out the form, and if you don't wish your
details
to be exposed.
Yes, so we do an anonymous testing where we will use anonymous name to send out certain tests. Those tests that you can actually get it done in my clinic, definitely that will be considered as unrecorded. Okay, so yeah, these are the things that we are doing.
Honestly, I will recommend you to just keep it in the record for Dr. John, because he will search through that what was the past
history, exactly.
All these things. I think it's quite important, and it's quite useful for Dr. John to recommend review all these things. So I was very clear and clean from the past one, but I just had a very active lifestyle last week. Very active.
Congrats.
Thank you. I enjoy it so, but of course there's a price to pay off. So when you come over here, register all these things, then we'll go for, you have to check your urine, then you have to go draw the blood.
Yes,
And
we will.
also that in this clinic, Dr. John offer a lot of different types of vaccine. I also have my MPV, right? HPV. HPV in the car. HPV. he might sell cars next time. HPV vaccine, which is lots of hospital in Singapore, they don't provide it. And the hospital in Singapore, they will recommend for adult below 25 years old. Yeah.
27 actually.
27. Oh, yeah. Okay. Yeah. So if you have any question, any vaccine that you need, you can always ask Dr. John. He also, if your foreskin is too long, he also have the thing for you to cut off the extra skin. A lot of things. And also, next time we're going to show you that one of the amazing things that Dr. John have will be the sound wave treatment. It's something like a machine to tap, 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 tap on your tools. It will help to generate good blood flow and then make it like hot like steel.
Basically, we call that a shock wave, where it generates an impulse to develop good blood vessels for you to have a better erection.
So now let's do with my test first, and then I'll go to P later. Then after that, we talk a little bit more about the PrEP. Yeah.
All right. So, okay, we are just going to do this.
So I got that I'm going to have my third dosage of the
HPV vaccine.
So I'm going to do it
No,
here.
it's MPV vaccine. I don't know which vaccine will bring you to which part of the world.
So usually we will not do it right over here because this is near it's just outside the lab, and then it's just right the machine. So this is the
Okay, so what we are doing here is actually the earlier fourth generation. Okay, so this is a fourth generation HIV test. Okay, so the accuracy is actually very good for this particular test, right? But it just needs to be taken properly with enough of sample, right? So we can just process the finger a little bit. Okay.
Any finger is fine.
Yes. You want to give me your middle finger? I'm fine with it.
So it's very fun about Dr. John that he talk a lot. So sometimes he'll be overrun all this thing. Yeah, we're scared. Really, I'm scared.
Chill. You won't even feel it.
Yeah, it's just a little bit of the finger feeling. Yeah. Then you can done all these tests. Because in Singapore, there are a mobile van that actually move around Singapore. They do the free blood test for the people as well. They open for everyone. But of course, you're happy to they're happy to take the donations from
Okay, just press.
Press. Okay.
All right.
So it's done. Then but this is for the HIV, right? But
Yes.
after draw the blood later, it will still have another test of HIV
Yes,
also.
predominantly we will do
Both.
HIV, syphilis, hepatitis A, B, C. It needs to be done. This is mandatory, and at least a kidney function. Yeah. So because when it comes to PrEP, you need to be sure that you do not have hepatitis B on board. We need to be sure that you don't have hepatitis B while starting on PrEP.
Okay. So what happened that how long will we get the result?
Well, basically this result takes about 10 minutes at the most. So you can actually see that the levels are actually, the blood is actually
Flowing up. Yeah.
So later we will actually...
So what is a procedure if I come here to do the test and then found out, I'm positive? What is the procedure?
Of course, straight away we will have to do your viral load and also your CD4 with all the necessary bloods before we want to commence treatment. But of course, the results usually will take about 60 to 75 minutes.
Oh, okay.
Yeah, so you get it on the same day, so at least it helps to facilitate your diagnosis faster and to know whether, do we need to add on any special medications at the same time.
Is that same for local and foreigner to come over here? Because I'm Malaysian, I'm not sure that let's say the Singaporean they come over here.
No double standard. Basically, no double standard.
Okay. Yeah. So after that, we'll go to another room to draw the blood, and then we'll continue to talk a little bit about the PrEP. Yeah, can I also have my vaccine?
Yeah, okay. So
this is another vaccine for the MPV, the HPV thing.
Yes.
So do you okay to talk about the price here? Because the price might go up and down, increase lah.
Yes,
so,
it probably will fluctuate, but you will always be looking at about maybe 600
Ringgit.
plus to about 700. It depends There are some clinics that are charging more, but it depends.
Yeah, the reason why I say like about Dr. John that he also provide very affordable price for the PrEP, vaccine, all this thing, and a lot of option. There are some not necessary items that Dr. John will also ask me that don't have to waste for the money and time for all that.
Yeah, we usually tend to discuss with our patients what is necessary. Then we will take it from there because each person's requirements should be personalized.
Okay, so I'm going to stop from here because I'm going to take my vaccine. There's nothing related about the PrEP.
Yes.
After the consultation, and then Dr. John will ask you to come to the other room. This is the room for the draw blood, and then behind me will be a bed for more exam. So in case that you need doctor to check on your private part, you had the mushroom growing, or you had some discharge, some liquid flowing. So that will be another bit for you to do it. So let's doctor to draw my blood first. But usually there'll be another staff, right, to do it.
Usually, sometimes my staff, but if they are afraid of taking blood, I will do it myself.
What do you mean your staff are afraid of doing blood? Don't say like that.
No, if my patients are scared of taking blood, so usually I will do it myself.
Not your staff.
So my staff will not do. I will be the one doing it.
Yeah. But I always prefer Dr. John to do it for me when he's not busy. So I usually come on the not busy time.
Exactly.
Yeah, but he's busy. Please allow him to check out with other patients. Because I noticed that when Dr. John draw blood, I don't really get a lot of bruises on the area. And I never want to see that.
Relax, yours is so easy.
Yeah. Do I need to squeeze my arm on this?
You can, but I don't think I need it because yours is super huge. 1, 2, 3, go.
So it's very funny that my hand is very near to Dr. John's private
balls.
So it's like I squat and squeeze it.
Yeah, when you're stressed, this is a good stress ball. All right, 2 stress balls. Okay. This is coming out slowly. All right, and we'll switch in between.
What's the difference of this pipe thing? Because last time some people are just using the.
Yeah, usually I will use this if let's say your blood vessels are very obvious and I'm very sure it's gonna 100% hit the blood vessels, then I will use this just for safety precaution so we don't have any needle stick injuries.
I see.
Yeah, but there are some that if you will do with the syringe like the typical old fashioned, that is only if I can't find the veins. So I need to use the ultrasound to help me find the blood vessels.
Really?
Yeah. It's usually those who are either they are overweight or the blood vessels are really, really, really small. Then that I will require to do something else.
So usually I will just check with Dr. John
Yes.
draw blood because
it's called it's releasing stress, right?
Yeah. Because until now, even though I do blood tests regularly, all this thing, I still never really dare to look at the needle poke inside me. Something else poked inside me is okay.
Yes.
I know what you want to say. I knew him so well and he knows me so well.
Yeah.
So done?
All right.
Yeah.
So
and also that after this I'm going to PP. If you're going to do the checkup, do hold your urine first because
at least for 4 hours. If you need to do for special cases, gonorrhea, chlamydia, those you have to hold for at least 4 hours.
yeah, so usually I will do all the screening because I'm very active, right? So yeah, that's the best thing. So remember, hold your urine. This is a machine.
Yes.
It's my very first time to come into the lab.
So this is our gene expert, which is your PCR that you are able to see things like your viral load. So we do viral loads for HIV, hepatitis B, C. We do HPV. So we can run everything here. Even gonorrhea, chlamydia, you are able to see.
Such a small machine can do everything.
Quite versatile.
Oh,
Even TB, tuberculosis also you're still able to do.
Is that someone?
Yes. So basically, it's somebody's can sample. Of course, no name.
No name.
But anyway.
Oh, okay.
Yeah. So yeah, those later we will actually run the process. My staff will usually run it. Yeah.
Okay. Cool. Yeah. Such a small machine, so cool.
Yes.
And I remember you told me that in JB, you're quite a first few person to have it, or you're the only one.
Actually, I am the only one in the southern region from Malacca all the way down to Johor.
Yeah, so if you need a fast result, you can always look for Dr. John.
Yes, that's a good idea. It actually, when you have a faster result, it helps you diagnose faster, and then it helps us, come up with a better plan as soon as possible. Yeah, so this is what we do.
Time is money. Would that be cheaper? Or what? I mean, of course, if you, let's say, from JB other clinic, they will send
Definitely,
to somewhere else.
if you were to send out, it will cost a little bit more.
Oh.
And it will take about a week, sometimes up to like 10 days.
A week? Oh my God.
So it's better to get this settled.
It's better to look for Dr. John. Quite
His
happy.
test is fine.
I'm ready for more. So I just done the HPV vaccine. So one thing I like about Dr. John also, he got a special technique to inject you with the less pain, with more pleasure. which is true. I think that the way that he do it is really different with other people. Then the result is out, so I'm happy that I can go naughty again. So I would say that using PrEP is really making my sexual life even more active. Not
And
good
safer.
and safer. Yeah, it's not a good or bad thing because I enjoy that a lot. So and Dr. John will never judge me because even though that sometimes like people, I got some certain thing before, then like doctor in Singapore, they're very angry. Yeah. So like they were like early morning that that happened to me. And then end up the doctor is my sister-in-law relative.
Oh,
so I went to the gathering. I saw, oh hi, it's you. Remember me? So yeah, that was a urine tract infection. And honestly, that time I was like not that active on sexual life. It's just there's a lot of things can cause a urine tract infection.
Exactly.
But a lot of people, they label it as a STD. And don't be ashamed or shy to look for help because it's just a label in the wrong way. And then the special clinic usually treat the skin disease on the STD clinic,
we
right?
usually do together with skin and also STDs. We do it at the same time.
Yeah, so people misunderstood that, oh, you got the STD or this thing. Yeah, but it's like, it's as long as treatable, get it treated as soon as possible so you don't wait until it's rotten or like swollen. Then you look for help, it's gonna be too late.
About to drop off.
So in terms of the PrEP, I'm happy that my results is all good. And then usually my very first time got the PrEP is in Thailand. So the clinic will give me all the PrEP up to 7 months. Then I have to wait for the email to see the result is all clear. Then I start to eat for my very first time. And in Thailand, I remember they will offer Thai made and Indian made and Germany made PrEP. So here, you have PrEP options.
Okay, so basically I cannot disclose all this information.
Mm-hmm.
The only thing I can tell you is we have a range from low to premium.
So like 2, 3 options or 5? Like do you have a lot?
We have about 4.
Four that's
options,
a lot. Yeah. I remember the last time when I took the very first generic PrEP, it's like blue color is quite big.
Yes.
Yeah, and then recently the one I got is like white color.
White in color.
Yeah, and I remember there was a time that in the gay cruise, I forgot to took my PrEP and someone offered me their PrEP. Those premium PrEP, they are very tiny. That's like so good. Yeah.
Okay.
Truvada, if I'm not.
I don't think so because usually Truvada and even the conventional PrEP, the size should be the same.
Oh, okay.
Yes, unless if you are taking another particular type of PrEP, which is a newer generation, which I am not allowed to disclose. All right, so that will be smaller because the dosage will be a bit different.
I see.
Yeah, so the pill will be smaller because the dosage is lesser.
I see. So is that which is a premium one the better or it's the same? Or why you offer like different types?
It depends because some of the PrEP actually may have some side effects for some people, but it's not everyone. So if it is a side effect that you are unable to tolerate, then you will actually use the other more premium brand.
So I'm quite lucky that for the past 10 years, I have never get any side effect yet. So what are the side effects they usually will get?
All right. In general, for my own patients, I would say 0.1% do get a little bit of stomach upset, a little bit of loose stool, a bit of dizziness, but it's something that they get used to the drug after like 3 to 4 days, and the symptoms usually just disappears on its own. So it's not permanent. And even if it is not suitable, this particular brand of PrEP, we have a few options to change.
Okay, so that's enough for the PrEP. Let's talk about PEP. So I know things might sometimes it's like the car can't brake on time. You might just happen to have unprotected sex. So what do they need to look for you in case of like just call?
Okay, so
I remember you were saying that there are a certain period, right? So let's say you are accidentally had unprotected sex, and then you are not sure the person is clean, or should I say clean or safe? How do you solve
what is the status of the
what
patient?
is the status
of the person?
Yeah,
exactly.
Then you will have to come to look for you. So you call first or what?
So basically, because PEP or post-exposure needs to be started within 72 hours.
72. So which means they have three days.
3 days. But the problem is when some patients, by the time they know about the existence of PEP, it may be close to 72 hours. So for me, please try to call my WhatsApp number repeatedly until I pick up. Because even if it's in the middle of the night, even if it's in the middle of the night, I will still take the call. Yeah, I have done PrEP outside of the clinic before, in the middle of the night.
So what do they need to do? So let's say I've not do I need to run any tests, or I just take the pill first?
Yeah, so basically we will have to run your HIV test to make sure that everything is negative.
So which means the person have to come to your clinic?
Yeah, preferably that will be the case, because sometimes you may be infected with HIV without you knowing, and then starting on PrEP without knowing your status is not advisable.
Oh, okay.
Yeah.
Okay. So which means that any of you in Singapore, Johor, Malacca, call Dr. John.
Because we will still be able to try to accommodate. When some of them they come.
So which means that they just need to do the poke thing and then see whether got HIV or not.
That is the minimal requirement.
Then they take the pill.
Yes, that is the minimal requirement for you to do the HIV test, the rapid one, and then you can actually start on PrEP immediately. But generally for me, I will usually screen for other STDs as a baseline, so that if let's say a month later you suddenly contract syphilis, then we will know that your baseline was without any syphilis on the initial presentation, and 1 month later you are positive for syphilis. That means that you have been infected by this particular most recent contact.
So for PrEP, I only take 1 pill a day, but for PEP, is that how long? 1 week? 1 day?
Okay, so basically, like PrEP, you're using on a daily basis.
Yes, it's very good, right?
Yeah,
I bring more money to him. It's actually not too much, but it's like, I think that's the best way, because anytime you got the message, you got the message that the person is right, then you have to go. So I would strongly recommend take daily. And for the PEP is how long?
So basically, once you start on PEP, you will go for about 28 days in total.
Oh.
Yeah.
Oh, so you have to buy the bottle is 28 days.
For 28 days, exactly.
Oh, okay. That is not too bad, right?
Yeah, it's not that bad. I mean, of course, if you were to balance...
What if like, let's say, would that happen that halfway the person took the PrEP, like maybe 1 week later, found out then, positive. Would that happen, or it won't happen that way?
In my experience, I've never had this happening. That's why we always check for the HIV part. But yes, if you do have PrEP failure, that is possible. But I've never had any failure in just 7 years of my practice.
I think that nowadays they are like 4th generation PrEP now. They are like 4th.
No. So basically, you're talking about the test.
PrEP.
So you have...
No, there's a pill. I saw that in Thailand. They will see that. Yeah.
So they have a few types. Okay. Even now, currently, there's a newer drug that you will inject every 6 months. So now there are many generations, but generally the cost is quite exorbitant. So we will still fall back on the cheaper version, because it is very prudent for everyone to be able to afford PrEP. Yeah.
Yeah. So hopefully that this video is helpful for you to get to know about PrEP and PEP, to enjoy an active sexual life, and do check with your your doctor first, because there are some country they are providing free PrEP, and some country they provide a very affordable price. It's not like Singapore. Sadly, that Singapore, a lot of people have no idea about PrEP, and most of the PrEP are quite pricey in Singapore. So a lot of our community people, they'll fly to Thailand or Malaysia to get PrEP, which is more reasonable price. So with that, yeah, anything on the add-on other than seeing you? Yeah.
Well,
Tested, play safe. That's all. The doctor always say the same thing.
yes, exactly.
Yeah.
Just make sure that you're tested. That's the most important thing. And if you have any other issues in terms of warts or skin issues, even if you're talking about HIV treatment, weight management, hair loss, we are also able to help you with it.
Yeah, just go to their website, because there are after I booked a hemorrhoid surgery, then I found out actually Dr. John, they provide a hemorrhoid removal service, and with quite a lot of different option ways.
Yes.
Instead of like I spent about 4,000 in Singapore, and then like I did nothing. He screened through my anal, and then like it's just a very tiny thing.
It was mutual, right?
Yeah. So of course, every 3 months I will try to come back again and make more video about the men's health. The next video I'm going to talk will be like the sound wave thing. I think that one.
Yeah. Shockwave. Shockwave. Usually we use it for erectile dysfunctions. We treat hormonal issues and like even those who
I think
like
we'll talk about the next one for the erection thing. Okay. With that, we hope you like this video.
Alright.
Bye bye.
Bye. Ciao.